This is the Plastic Principle.
All right, everyone, welcome to the Plastic Principle podcast. Today we have a very special guest, Dr. Ashkan Ghavami. If you are in the field of plastic surgery or have any interest in plastic surgery, then you know that this man needs no introduction.
Thanks.
But I'd like to introduce him anyway, because he is a superb plastic surgeon here in the Beverly Hills area. Dr. Ghavami trained at one of the best programs in the world at Dallas, the Southwestern University of Texas Southwestern program in plastic surgery, one of the most prestigious programs, fantastic place. And after that, came here and settled and made a practice in Beverly Hills, and very quickly established himself as one of the most prominent and successful plastic surgeons.
Thanks, John.
Yeah, absolutely. And someone who has contributed a lot to our field, writing tons of articles, book chapters, presentations, lectures. She served as the president of the Rhinoplasty Society, which is very prestigious. And so and I've said this to you personally, that you're one of the few plastic surgeons. Oh, and by the way, forgot to mention that also has been known for being a celebrity plastic surgeon, right? And so I've told you this personally, that I really admire the fact that, although you're someone that has had this fame and is so well recognized, you've never let go of that passion and that love for our field. And you've always contributed through your academic interests. And so that's something that I think is rare.
Yeah.
So I really commend that.
Thank you. Thanks. It's exhausting, but I appreciate it. I have so much respect for you from day one and what you do, and you carry everything forward with class. I mean, you can just tell from the way he's dressed. He's a classy guy, classy surgeon, talented.
Well, he's wearing scrubs because he's so busy. Because he can't fit all the surgeries.
No, it's because I was just like, I couldn't pick my outfit this morning. I was running late. I'm like, you know what? I'll just wear black. So, I appreciate that. It's people can get lost, honestly, whether you're in Idaho or Beverly Hills, you can get lost in the social media landscape and celebrity, and you get a few famous, even in let's say you're in I don't know, middle America, and you get some NFL player's wife, and you start working on NFL player wives. Everybody has their niche that are these celebrities in that town or their location. And the whole point is we took an oath, literally, to become physician first, surgeon second, and for us, third, plastic surgeon. So we have a responsibility to ourselves, our patients, the advancement of the field, which both you and I still love, even though we both have some gray hairs. We still love what we do daily. Otherwise, we would not do it. Trust me, there's nights I go home at 9 p.m. and I'm exhausted, but I feel like I did something good. I mean, we're not curing cancer, but we're improving lives. We're doing that and doing a lot of benefits to the patient's lifestyle and dynamic. I mean, I've seen marriages come together, break apart. I've seen people get engaged. I've seen people just get a whole new lease on life and just become empowered. So all these things are so important. It's not always just about treating blood pressure, hypertension, this and that. And both you and I are also health conscious of ourselves because we have to be the best for our patients, but also in this realm of biohacking and wellness, which is so confusing, I think you have to incorporate all of that into your patients and be holistic in a way. And plastic surgeons now, that's why so many do peptides for their patients. But it's easy to get lost in that, especially out here. You get a few celebrity patients, you get invited to a few parties. We see them at lunch, at dinner when we go out. We see them. It's nothing. This, for us, it's normal. I see these tourist buses blocking around Holland, and then I'm like, ooh, what celebrity house are they looking at? And then but I've always, maybe it's my pedigree, maybe it's training with Rod and Steve Bird and Guy Ron and those Fritz Barton and those guys. Who Fritz Barton was my first podcast host, by the way.
Oh, great!
My guest. I think they just instilled kind of a bug in me to just continue doing scientific publications and lecture and do things like that. So for now, it's here to stay. It's part of what I do.
Well, you just touched on about 5 different topics that I want to cover.
Yeah.
But let me begin by saying, number one, I think, today what we're going to talk about is the confusion around plastic surgery, and specifically around and the chaos. Yeah. So we're gonna tackle that if we can, and specifically about facelifts, because that has really emerged as a really hot topic, especially for the mainstream public. The other thing I wanted to mention is you were talking about how as plastic surgeons, there are so many things that we can touch on.
Mhm.
That's why I named this podcast the Plastic Principle, because as you know, plastic, our specialty was named after this idea of molding,
Yeah,
or plasticos,
plasticos,
which is
yeah.
to mold.
Yeah.
And I always tell patients, and whenever this conversation comes up, that this principle of taking something and making it into a better form. That's what we do with reconstruction.
Yeah.
That is what we do with reconstruction. We're taking something damaged and making it normal.
Mhm.
And in the case of cosmetic surgery, we're taking something that's normal and making it better.
Yes.
But that same principle you can apply to everything in life.
Yeah.
Whether it's relationships, yourself, your health, your education, your career, right?
I mean, the definition of life, the definition of, what the Greeks call eros, or like life force, is change. Like, if you go somewhere where, if you look at Game of Thrones, they say winter is coming. It could be 100 years long. That's one season for 100 years. That's no change. It's like dark. Change. You look at the leaves, they change. Trees, the way the ecosystem forms, you can always learn from nature. And as surgeons, we have to evolve. And we'll talk about our kind of resurgent passion in facelifting. I think it's important. It's given me a pep in my step, if you will, and a fire under me to do that. But we need to be changing, and what we're doing is we're molding our patients, and it's kind of cool what we do, because there's one day where I remember I did a 9-year-old's otoplasty, hitting the ear back, where we take the ear, suture it, move it back. This rock and roll guys who I really admire, son, hitting his ear back. The next one was a breast augmentation, and the third one was a rhinoplasty.
Right.
I mean, if that's not variety, I don't know what is. And it's not only just in the type of surgeries, but the type of patients. I changed that 9-year-old's life. Now he's not going to be teased. He's not going to be bullied. And then secondly, you have a breast augmentation, which I always joke around and say we're making the world a smaller place. But basically, breast augmentation, we know how it's almost immediate gratification. As far as surgery goes and recovery, and I know recovery is important for you too, it's almost immediate gratification. Like, people really just all of a sudden get empowered to shop differently and carry themselves with a certain posture.
Absolutely.
And then, rhinoplasty is center of the face. So like basically 3 people's lives were altered and molded, plasticos. And, the seasons in their life in a way changed based on our intervention and what we did, and it chose us to do, which is such a privilege.
It is. Yeah, I never forget that, and I think we share that same approach and philosophy. And I wanted to also mention the fact that you said how we take this oath and how we value what we do so much and consider it a privilege. And that's another thing that is an important theme of this podcast, and something that I want to talk always about is just how our mission is to take great care of patients and educate, which is why when we were talking about this podcast, we're like, this is a topic I think that we need to discuss.
It's so chaotic out there right now.
So tell me, so Dr. Ghavami has been doing, he's a master of every procedure. We were saying how we both love to do all the procedures, but like many plastic surgeons, as you evolve in your career, the face is it's almost like the epitome of all the art.
I believe that.
Rhinoplasty, right? Which you've been a master of, but also now facelifts. So tell me what you think what have you been observing in the last, let's say, year? Because it's interesting how it's become such a hot topic in conversation.
Well, I mean, I don't know if me and you talked about this specifically personally, but I went into plastic surgery, the field, to do nose jobs and then to do facelifts. Those were the 2 things. I never thought I'd be doing S-curve buttock surgery. I never saw or learned one single fat transfer buttock in residency. And to this day, still, residencies don't teach it.
Yeah.
So that's why in our fellowship, they get that experience of learning. We say, I say hairline to toes, basically surgery. So essentially, the face is so important because, if your breasts are a little bit droopy, or you have large breasts, or you have a body that you can now fit into Skims or Spanx and like work out and improve and look good under clothes, the face can't do too much. You can do some makeup here and there, get your hair the right style for your facial shape, but a facelift to me is like kind of the creme de la creme. Like the face, working on the face, the nose. The nose is so challenging. As you know, you could do every single minutia step right in a rhinoplasty on someone, and then 9 months later, a year and a half later, you're like, what happens? Like, it has some unpredictability to it in everyone's hands. And trust me, when I wrote edited my textbook, and I had Dean Toriomi, Rod Roy, Guy Ron, all the giants write chapters in my book on it. I've talked to them personally all at these meetings, and they're always surprised by certain results. You just can't guarantee a result in anything, especially rhinoplasty.
And great surgeons have the humility to recognize that you can always do better. You always will have more to learn.
I tell patients, I'm like, look, this is, I'm going to get you 90% of the way there, 85% of the way. The rest is kind of up to you, wound healing. Rodberg says God and wound healing. So like the forces that happen when you leave the operating room, we can't fully control. So facelifts, I feel like, are a little more predictable. So in that sense, it's kind of like a relaxing thing. It takes like 5 to 7 hours to do a full face ride. You get to sit, and instead of rock and roll, I play like more like chill Pink Floyd, some classical, some jazz. It's like a whole different vibe a lot of times. So I love facelifts. Facelifts, I was fortunate enough in Dallas to have Fritz Barton and Sam Hamra and Rod Rorick and Steve Burrows on my shoulder.
Right? Yeah, these are the gods of facelifts.
Yeah. So we all had exposure to all these guys, and Barton was one of our main guys, and he was actually completing his textbook in my chief year. And in my podcast, I interview him about all that. And so we can get into styles of facelifts and all that, but when you're exposed to people like Baumann, Guyon, Rod, and Hamra, and Fritz Barton, you're gonna definitely get into facial rejuvenation. And, Guyon and Bird were two of the innovators in brow lifting, endoscopic brow lifting, which I know you're a fan of. Like, you can really customize the brows. So, and right now it's just chaotic because people talk about brow lifts, and like you can go and do a brow lift like 10 different ways. And that's the thing with these surgeries. Someone just says, oh, she had a brow lift. You have no idea how much dissection went on, how low they went, how many of the ligaments and attachments they released, where did they release them? Did they do anything with the corrugator muscle, the muscle that we Botox, the 11111s, and in my case, 1111s? Did they remove it? Did they weaken it? Like all this stuff. It's always been a passion of mine. And in Dallas, we had that anatomy lab every year. So when they were done, we had like 150, it sounds a little gruesome, Game of Thrones, but we had 150 cadaver heads we were able to do studies on. One of the main ones I did was on the corrugator. So brow lifting, facelifting, all that for me is so nuanced and so fun. And I know you feel the same way. And it's something that as we're getting a little older, and I always was taught, I don't know if you were told this, as you get older, your patients get older with you.
Absolutely. And
so I'm a facelift age. He still looks like he's 25. Jan has a full head of hair. When we're offline, you better tell me your secrets, other than genetics.
The facelift I got.
Yeah, right. So, there's so much chaos right now because now this celebrity thing's been thrown into it.
Yeah.
And it's kind of crazy for like one surgeon to get this credit as just like this guru Gandhi of just like Dalai Lama. I don't know, but it's like, come on. And we all know the different techniques. So we know who does what. That's the cool thing about plastic surgery. If you're in the know, and John, president of the LA Society, has exposure to all that when he was president, and he knows the landscape. I remember me and you were having conversations during COVID. What do we do? Regulations.
That's right.
We've been through a lot.
Yeah.
But when you talk to somebody like us who's been around in a while, we kind of know what's BS, what's not. We know what surgeons do, what techniques. We know that facelift took him probably 2 hours, 3 hours. And we know that guy probably spent 6 hours. And, and what he did was a little different, more nuanced, cultured. So it's really, I would not want to be a patient right now because I would be so confused myself.
It is very confusing. Yeah. And I think a lot of this started when this term deep plane was introduced.
Yeah.
And what's confusing is for us, we know exactly what this is. Plastic surgery. Our plastic surgeon and our field, we've been doing this for 60 years. And so these techniques are very well known to us. So the deep plane technique is not a new technique at all. It's actually old.
Yeah.
But the problem is for patients and the average person, when they hear these terms, it's hard for them to make sense because you're talking about a very technical thing that we have conversations about because we're talking about the layers and where we enter these layers and how much we pull. So there are very clear definitions for us. But for the average patient, they're like, the deep plane sounds like it might as well be a completely different, new, revolutionary, innovative procedure, but there's a history behind it.
Yeah.
So what are your thoughts about how when this term came out, I have patients telling me, well, I want the deep plane facelift.
Yeah,
That's a
I
facelift.
don't even know what it is. It just sounds good.
Yeah, that sounds good.
You know, it's kind of like when you say, like, I meditate. Like, okay, does that mean you spend 3 minutes closing your eyes, taking a few deep breaths? Or are you doing Ayurvedic? Are you doing Vedic, where you're doing 20 minutes with a mantra? Are you doing a walking meditation? Like, everything is so varied and nuanced. Deep plane, and I asked Barton about that. The exact question you asked me, I actually asked Barton. And he's like 1980s. So 1980s, Skoog and Blemin. The Skoog was a Swedish surgeon.
Skoog invented it.
Pretty much. Like, he's the first one that's like, why are we just going under skin?
Right.
If skin was reliable to hold your face up, we wouldn't have to do a facelift, because skin doesn't really get that loose, honestly, on the face, unless you lose a lot of weight. So if skin is not the vehicle that's holding the face up, why are we just lifting that and thinking that's going to last? And I'm going to definitely have to touch on lifestyle with this thing. And thank God they're not around anymore, so I can really say my piece on it. But deep plane just means you're going deeper. You're going under the SMAS, superficial muscular apneuritic system. And, you know, Mitz and Peroni were fellows in a lab along with Tessier in France, and they discovered the SMAS layer. Skoog did the deep plane and went under it. How much, we don't know, but he kind of ventured under. And then you have people at Hamra that went and combined it with skin and everything as a composite.
Right.
And then Fritz Barton was doing an extended high SMAS version where you come above the zygoma and do a much more extensive dissection in the deep plane. These are all deep plane, which means you're underneath. And there was a moment where people were doing subperiosteal, where there's right in the mouth, and dude, that's the deepest you can go.
Right? Bill.
He was one of them. That's the deepest you can go.
Right.
So here's the nuance. If someone's meditating and they're taking a 30-second meditation, are they meditating? Yeah. Right now, if I took 30 seconds, took a few deep breaths, took my mind somewhere that just was nowhere, I would do meditation. I would call it meditation. But try to do like a 3-hour Eat, Love, Pray, Julia Roberts type meditation. That's deep plane. Or what Dalai Lama, where the gurus, the monks do, where they're just silent for days or weeks. I mean, some monks, they, you know, I heard that one monk was talking about his training, and he was not allowed to do certain things in advance until he learned how to eat a raisin for 3 hours.
Wow.
Like, digest, feel the texture, eat a raisin, and take 3 hours to consume that raisin and really feel it. So are you meditating? Are you doing a deep plane? Like, so here's the question. So if you go under the SMAS for 2 to 3, 4 centimeters, just take a look and a peek. It's not going to do much, right? You might as well just do a SMASectomy like Dan Baker and just remove a strip, which works great in some people. By the way, all these techniques with the right patient and match procedure to the right surgeon that's really good at that can probably get somewhat similar results. I'm biased, and I think for a long-lasting one, you do need to go deep.
Yeah.
So, so if you go 2 to 3 centimeters, is it a deep plane? Sure, but like, is a 30-second, is it a meditation? You know? My preference is when I can, no matter what the age is, to try to go high SMAS the way Fritz Barton taught me. Deep plane in general right now is what in Dallas, Bird and Barton and everyone would call it low SMAS, which means you're entering the SMAS a little bit lower, about right here, whereas the high SMAS is up here. And then some people do this sailboat modification where they go a little bit like that.
Yeah.
And the whole point is the SMAS is fixed about this much to your parotid spit gland. From that point on, it's mobile. So you have to venture. It's almost like you got to leave the shore and go into the ocean. Like, you got to leave that area and go deeper and go enough to be able to recruit. And I think the key is to go under the platysma. When you can go under the platysma far enough and you've recruited all the mobile SMAS beyond the shore, beyond the parotid gland, then you can actually go vertical parallel to the zygoma angle and really do a true vertical restoration or a deep plane, extended deep plane facelift. That is deep plane. That is at least 30-minute, no speaking, eyes closed meditation, which I won't demonstrate.
And maybe you could share at the end how you're doing meditation. But I was just going to share, because we do have video, but for anyone listening on audio, what Dr. Ghavami was pointing out is the different levels where the surgeon can penetrate the SMAS layer, which is the layer that invests the muscles of the face. And so the high SMAS, you're going up about maybe like close to the temple area.
Yeah, above the zygoma.
Above the
which
zygoma.
is safe. The frontal nerve's already deep to that
Right.
and going somewhere else.
Yeah. And then, so a lot of these techniques, they're all deep plane, but they were not necessarily called that because the idea was where are you penetrating? So high or low.
Yeah.
And then to your point,
And how much of it are you recruiting?
that's right.
And I always use the bed sheet analogy. Like, when you get in the hotel room, it frustrates me so much. Sometimes I want to call room service and be like, how strong was the housekeeper that I can't even lift the sheet up? If you can't elevate a sheet in a hotel room, you can't get under it and get any movement.
Right.
These, instead of the housekeeper tucking it deep under there, God has made these ligaments.
Right.
You have to release the ligaments to get movement.
That's right.
If you're not going to get movement, you're going to go, and that's going to last about a year or so. So we can talk about lifestyle lift, right? They were talking about the Mickey Mouse and no offense to Disney, I love Mickey. My daughters love Mickey. We love Disney.
You do not want to get on the wrong side.
We love Disney and I love ABC. But, let's just say not an extensive version. Like Hasso in France in 1919 was removing little ellipses, like temporal lifts, kind of brilliant for the time.
Absolutely.
Little lifts and then just tucking them up and you would get little pulls, almost like a little bit beyond a thread lift. Lifestyle lift wasn't that different than that. They were removing a little bit of the skin, maybe plicating a little bit and tucking. How long do you think lifestyle lifts lasted?
Less than a year.
Yeah.
So for maybe the listener who doesn't remember the lifestyle lift, because the shocked word of this.
Do you remember their infomercials?
Yeah.
The light was so bright. You're like, where did her wrinkles go? Oh, she's being blinded by light.
So there was this humongous marketing campaign for this company that called themselves Lifestyle Lift.
Yeah.
And what they did, it was national, which was I think the first time I had ever seen something like that.
Yeah.
And
facelifting on an infomercial, yes.
Yeah. And then they recruited doctors from all around the country.
It was brilliant marketing.
It was brilliant marketing, and they were basically selling this idea that you can get this facelift result
1 hour
in very short time for very low cost. But like most things, if it sounds too good to be true, it probably is.
Yeah.
So they quickly, I think, ran into issues with quality control and people that ended up eventually.
Yeah, but a lot of the surgeons that worked for them ended up becoming pretty good surgeons and doing the right thing later.
Right.
Well, and I think they had some a la carte options. Like you can do a little bit of a neck lift. So platysmoplasty, you could add it on. I don't remember, but the bottom line is, it's really hard for consumers and patients that want to look into this to decide, but you got to see if the results are honest from the surgeon. Hopefully there's some video, not just photos. And now with AI, they can probably deep fake videos too. So I always prided myself, as you know, I was one of the first to recognize Instagram as a tool for us.
Yes.
Back in 2014, I posted my first before after. And then once video came, I started doing video in the OR, putting it to music, like as early as 2015, 14.
You were definitely an early adopter.
Yeah, I was like, and I was being made fun of at the time, like, what are you doing, Ash? But regardless, it's here to stay. Social media is not going anywhere. We're going to probably soon have holograms delivered to your room, your bedroom of like whatever you want to be interested in. So you're going to be seeing a surgeon operating on your bed or your couch while you're watching it. I think that's next.
Yeah.
But the bottom line is, I don't know how in the future it's going to be, but right now I would just look at a variety of results. But more honestly, I mean, I don't know about you, I'm sure you're the same, but I only post 10 to 15% of what I do.
Yeah, of course.
It takes a lot of time and effort to get the patient come back.
Absolutely.
A lot of my patients don't even live in LA. Get them to come back at the right time. Get follow-up photos. Make sure the photos are good. The person that took them didn't do a weird angle. The lighting's not off. Videos, I mean,
make sure they approve that they
exactly
approve,
consent, all that. So and just sometimes I just want to just go and operate and go home, and I don't want to worry about filming anything. It doesn't take time. It's just another thing to do.
Yeah.
So I think, me personally, I post about 15% or so of what I do surgically and in clinic, and there's so much you guys don't see of both Dr. Diaz and myself. And so you just got to get a sense of the surgeon. It's a very sacred, intimate thing for you to go to sleep in wherever you go when you go to sleep, and have someone cutting on you and doing surgery, manipulating your anatomy that's so sacred. So that's a bond that's so important. And a lot of patients these days I don't think understand how important it is. But you get a certain instinct of your surgeon. You look at some of their work, you're like, I think he can do a good job on your sheet. And then I don't want to get into reviews, but like people go write reviews 2 weeks later and like you haven't even healed yet and you're already interfering with the doctor-patient bond and the doctor-patient relationship by going and just that those things don't make sense either. So,
well, I think patients, I think you're demonstrating something that I've talked about, and I had Rod Rorick as my first guest, by the way.
Nice.
So your former,
We both had legends.
yeah. And one of the things we discussed is the authenticity and sincerity of the surgeon. So I think if you're listening to Dr. Ghavami right now, I think it's obvious that he's genuine about the surgery and what he's doing and how much he loves it. And as a patient, when you're talking to the surgeon, an honest surgeon is going to tell you, listen, this is what I do. This is why. These are the options. And if you ask a question, well, what about the D-plane? They'll say, well, this is actually what the D-plane means. And because there's a lot of confusion.
And they shouldn't be bad-mouthing other surgeons. I think that's a rule too.
Yeah.
Like, I don't go say, oh, D-plane, like whatever. Like, I do D-plane, but it's a different version and it's more extended. But like, it's confusing. I don't introduce a lot of terminology.
Right.
But both you and I think the same way. I've had, when I came into town, I had people talking like, some of the facial plastic ENT guys, because I always loved noses. And as Dr. Diaz said, I was president of the Rhinoplasty Society a few years ago and have a textbook and all that. It's one of my main passions. It always will be. As hard as it is, I'm here to, if you walk into my clinic, you're getting a nose job. So don't walk into my clinic, and you don't need one. So basically, I take all that in stride, and it's so important for me, and the relationship I form with the patient and matches the difficulty. I'll talk to them honestly. I'll say, this has some unpredictability to it. This is a technique I do, but I actually don't ask for op reports a lot of the time. All that does is ruin the relationship further between that patient and the surgeon, unless there's something I'm really confused about. But honestly, like for rhinoplasty, does it really matter? I can send them for rib, cadaveric rib, ear graft, everything if I'm doing a revision on them. And when I go in there, does it matter if the surgeon put a graft here or there? The nose doesn't look good, it's not breathing good, I need to fix it. So for me, I think about this differently. But I try not to talk about other techniques, other surgeons' techniques, but there's so many terminologies that are confusing. You have D-plane, you have ponytail, you have vertical restore. I'm guilty of this. I came up with Regenilift. We'll talk about that, but it's because I have Regenilift 1, 2, 3. I think it is important to do a graded classification because you can do hairline to clavicle restoration with a nose job eyes, or you could just do a high SMAS, or you could do a SMASectomy with a little bit of neck lift here, but not here.
Well, I think you're bringing up something that I wanted to make sure we discussed with the audience, because one of the things you're demonstrating and you're saying is you're talking about all these different techniques, and it depends on what you find, and it depends on what works and what the patient wants. And this is, I think, another thing that's confusing for patients, because I understand from their perspective, they probably think that there's one procedure, that one thing fits all. And it really is.
Even a deep plane has variety to it.
Tremendous variety. And not everyone needs a deep plane. So I think, it's important to understand that sometimes a certain procedure done by a surgeon, that surgeon may achieve an incredible result with that technique. That same patient goes to another surgeon, maybe that surgeon, in their hands, they use a slightly different technique. They can get an equally good result. Yeah. So it's not like there's only one result one technique that can achieve things. It may be a combination.
And some people need different ones.
Yeah.
Depending on their age, their anatomy. If I have someone, for example, with a very full face, and they're in their 40s, but they have laxity, they have jowls, a very full face, I'm going to do a different type of technique. I'm going to want to remove some of the SMAS. I'm going to do some subcutaneous under the skin fat lobule removal. I'm going to possibly go a little deeper, remove the digastric muscle a little bit, really try to sculpt. I may add more fat to the chin or a chin implant to bring it forward. I'm trying to thin out their face, going from square, round to triangular, which is usually one of our main goals for all faces, right? Because we all age this way. Look at me. If I didn't have a beard, so you have to match it to the patient, and if I have that face, I'm going to do a different type of SMAS. But I'm always going to go on this. I'm always going to try to go into the SMAS. Like sometimes I had somebody recently who had trauma and fell on their left face, and she had a scar like this. So probably her whole facial vessels were gone, and her SMAS was like almost non-existent, very rare. But in general, you can do something with the SMAS.
Right.
So in a fuller face, I'll remove some or do a very large mastectomy. But then when I'm done with my mastectomy, I'll do a low SMAS and recruit the platysma. I want to go under the platysma muscle. In a thinner face, I want to do more fat grafting, and I want to do a more vertical high SMAS. So, and the key is, I think your surgeon should have a lot of tools in their toolbox, technique-wise. And most importantly, most of what we do is analysis. You have to evaluate the face. You have to evaluate the breast. You have to measure the breast. I don't measure the face. I evaluate it, right? For the breast, it's a little different. We're putting an object in there for now, and so you need to match the size to the patient. John Tebbets, God rest his soul, one of my mentors, was one of the creators of dimensional analysis. I mean, the whole reason we have a caliper is because of him.
Well, I always say what we do, it is an art, but there's also a science.
Yeah.
And you can't ignore that.
You have to know both.
Right.
Yeah.
So with all these different techniques, that's why I think I would be remiss if I didn't bring up the enormous interest that Kris Jenner and her reveal created. Because when she came out, I mean, I was getting texts from friends.
You know, it was like Kennedy's assassination. I remember where I was. I remember where I was, where I saw that like one surgeon was getting this tremendous credit, and like, God bless him, such a lucky guy. I would just love if just 2 of my surgery patients came and admitted to surgery.
Right. And then you've had many, but this is a good point, because, you know, when she came out, everyone was speculating, what does she have? And it's hard to know exactly, because like you just explained, there's so many different techniques. How can you possibly know? But inevitably, so many people ask, and so many people are interested. And us plastic surgeons, you know, I know that day in the office, everyone was just asking me, what do you think? What do you think? And then saying, you have to post about this. You have to post, because it's so interesting. So we sometimes are under pressure to try to guess, even though sometimes you can't.
Well, some of us know also, you know, we when you're in the know, you kind of know. You know, like I remember the first time I learned Marilyn Monroe had a chin implant. What? John Wayne had a blepharoplasty. Like some of the queens that I admire from back in the day had tummy tucks. Like
plastic surgery goes way back.
Yeah,
a lot of people don't know that.
500 BC. That's a whole other story, with forehead flaps from sword fights in India.
That's right.
So, you know, I think it's a little bit, and I know Rod and Bill Adams love to do this, and I get it, because it's popular, and, you know, it gets you views, and it's interesting to comment. People will always celebrate celebrities. That's why they're called celebrities. We celebrate and iconize. That's the word, iconize? Iconicize. We iconicize. It's the end of the day. We iconicize these figures, and that's been around since, you know, tribal era. They always pick one shaman that they just look up to, or one person who's the main tribe member, or some, you know, as human beings, we like to see this, but we also like to see them go up, fall down, go up. That's why so many movies and so many celebrity stories have comebacks to them. Like, we love seeing this comeback. That's why people love seeing Lindsay Lohan looking so good.
Yeah, sure.
Because she's always cutie, gorgeous, and now she's this elegant woman who probably had something vertical done. I personally don't comment on celebrities, because when I first got into practice, I commented, I remember, on one specific celebrity, and I was way off, because they showed me a swollen photo of him where he had like, later I learned he got like bee stings and had an allergic reaction, and he was all puffy, and they were like, what did he have done? I'm like, I don't know, he probably had fat grafting. So, and I was way off. So in general, and you and I both have celebrity patients, a lot of times the people that comment and guess, they're wrong. And so they're giving the public wrong guesswork information. We all know, looking at Kris Jenner, obviously she had something surgical. This was not a thread lift or etc., and probably some skin treatments. But in general, like, to guess doesn't really matter. The point is that obviously this wasn't skincare. So we know it wasn't dermatology. So it was plastic surgery. It wasn't she went to the sauna instead of 3 times a week, 5 times a week. It was surgery. Let's get real. Now, it'll be interesting to see how that surgery lasts, how she looks without makeup, her hair, without the bright lights of red carpet and events, which You and I have both been on red carpets and stuff in LA, and it is so bright and so hot from the lamps that like it cooks your face.
Yeah, it makes you look different.
It takes away all your wrinkles. You look amazing. You're like, it's natural. It's the filter before filters existed.
Yeah.
It's Hollywood lighting.
Yeah.
So it just doesn't make sense to guess.
Yeah. No, you're right. I think that's a good practice. Now, I did guess, and I guessed wrong.
On Chris?
Yeah.
Oh, yeah.
And Ghavami, you texted me and said, I think
it's something else.
yeah, it is something else. But the reason I did think she had it is because she has this characteristic, very full cheekbone area, very full mid face, which is not common in someone her age.
Yeah.
And the other thing is,
I think she admitted to a previous facelift with Garth.
Right.
Yeah. So it's not her first rodeo, right?
Right.
And it shouldn't be at that age. If you're in the limelight, most people, I know 25-year-olds in the industry,
Absolutely.
they've had already 5 or 6 different things done. Rhinoplasty, lipo, all sorts of stuff, right?
Yeah,
it's very rare to find someone in Los Angeles or in the industry who hasn't had any surgery at all.
Yeah, especially like you said, people in front of the camera.
Yeah.
They're under tremendous pressure to look their best.
Yeah.
So I saw this full mid face. Her upper face looked more rejuvenated, and it was characteristic to me of this other technique which we didn't touch on yet, which is the endoscopic mid facelift. And so I had speculated that maybe she had that because it looked like results that looked like that.
Yeah.
But
something happened with her next skin, which that won't address, right?
Right. And you can combine them.
Yeah, and that's one of my favorite things to do.
Yeah. Because it works so great.
Yeah, especially in young people too. So like what Steve Bird would do all the time, and I assisted him on this, and I've done it on my own family members with him over my shoulder, and like it was phenomenal. I think he's retired now, but he was a surgeon in Dallas I trained with. He would do endoscopic brow mid-face lifts.
Right.
And then he would do this incision, but then he would do a low smash, what we know now as a deep plane, because they approach about here, usually, not much higher. And so he did a low smash to address the platysma. We went under the platysma, plicated the platysma centrally, got a really good recruitment of the platysma up and this way behind the ear. So he got a really good lower third addressing that, and then he got the mid-face from above.
Yeah.
So he didn't need to go into too much extension here. Up here, you have a mirror system. It's very similar. The arcus marginalis, the joints, and that's what holds your brow from not moving too high up.
Right.
And it's what retains and holds this muscle and makes it powerful. Just like your girdle muscles hold your glutes powerful so you can jog, run, and run away from a bear in caveman days. It's all evolutionary. These muscles here now, like depending, like he doesn't have much, either he Botoxes or he's a really nice guy and doesn't do this a lot. But if you get upset a lot, or not, like me, you have naturally large muscles, prominent ridge, you can go tailor that muscle. So he was very thorough, just like Bahman Gairan, who I also trained with. And then he would go around here and grab the mid-face. And that's the thing with Fritz Barton's high smash technique. Because he's above what you're lifting, he was able to go and recruit this mid-face lift cheek. And to me, that is what creates that elegance. Now, if somebody already has big cheeks, like Kris Jenner or someone else, where they have fullness or they've done fat grafting or they've had a previous facelift and this is okay,
Right.
you don't need to go and do all that maybe, but I still would try. You can just go remove a strip here, stay a little below that and do your work here. But the high smash allows you, because it's high above this, you can't lift something that you're under. Not in facelifting.
Right.
You have to be above it to bring it to you. Yeah, so you can't lift something from off the ground if you're underground. Does that make sense?
Yeah.
So for the brow lift and endoscopic, if you know that anatomy, you can recruit this. And Maripani, Chachakeo,
Right.
a lot of people have mastered that too, and it's powerful, but once again, it's all in taste and flavor too. How much do you lift the brow? How much do you release the ligament here for it to not move apart?
That's why I was speculating that perhaps she had that because of the vertical improvement I saw.
Did you notice a brow lifting on her? I didn't see.
No.
It could be good Botox, but yeah, she definitely has skin. Like a lot of people, like it's also, I'm sure you do the same thing. If you're going into rejuvenating face surgically, I'm going to do something to the skin. Either a light TCA or a deep TCA or some sort of erbium or CO2 laser or something.
Yeah. And then I think I agree with you 100% that it's the comprehensive rejuvenation, right? So as you were saying, Steve Bird would lift up here in the mid face, but also then you have
He
to
would
address the neck.
yeah.
And they're different. And they're different.
Sometimes he would just do it around mid-face.
Yeah.
He did a lot of fat grafting. In fact, him and Rod Rorick were the big fat grafters to the face. And that's how I extrapolated and out of nowhere, kind of just reading Mendieta's one article, translated that to buttock and then later breast. Like, we never learned it, just use bigger cannulas.
Yeah.
But same thing, the way I move, this, that, it's just macro versions of the face.
Right.
So they were doing a lot of fat grafting, so they didn't need to recruit the cheek and everyone. But with an endoscopic brow mid-face, a little bit of fat grafting in certain areas, nasolabial fold, and someone's like late 30s, early 40s. Back then there was no Ozempic. And you don't need to do the neck sometimes.
Yeah. Yeah, and I feel like our knowledge, our understanding of anatomy and aging has improved so much. I think the results today are way better than they used to be.
Yeah, they are. Even the average surgeon today, I would say, gets better results than maybe a really good surgeon in the 90s.
Yeah, I think you're right. Even just looking at results from articles, like, sometimes.
Those articles,
yeah,
because you go out flying.
Right, exactly.
They'd be like, what about the jowls? Why didn't she do her upper eyelids? Like, everyone has an opinion.
Yeah, and I think the sophistication of the procedures today are much better. And we know we have to treat all these different aspects of aging. So you mentioned fat grafting, because we know the face deflates with aging and loses volume. The neck, where the neck, begins to age, it's a different direction than the upper face. So you have to I think a lot of surgeons now understand that there's different vectors or the directions you're pulling and different layers. So I think that's why the results are so
And how much you pull and how much you, in order like the bed sheet analysis, how much you release. Sometimes I'll release the bed sheet just enough to get under it. Sometimes I want to completely release that ligament, and so I can just relax. It's claustrophobic. But I think, the same analogy, if you think about it, is for faces. You have to custom release to pull. And to pull effectively. Now, how much and how high and how tight you pull, that's where judgment comes in. And so that's why every surgeon is different. If I know a few other surgeons, some of them are younger than me, who trained also under Dr. Barton, who do high SMAS like he does, but they probably do it a little differently than I do. And we probably all do it a little differently than Dr. Barton did. So I'll sometimes do more fat grafting than he did. He usually didn't do that much of it or at all. He didn't really believe in it too much. But, it's hard for, as a consumer, as a patient, prospective patient, to know all these things. You just have to know that, okay, this guy's not full of it. He's overall just obviously an adept, expert surgeon. If he's doing facelifts or breast, whatever he's doing, he's going to be good at it. The results I've seen look good. He's talented, he's honest, and he's going to figure out how tight to pull my face. I don't have to worry about all that. But people get bogged down, just like in implants, 15 cc's here, 20 cc's here. Wait, should I do soft touch or should it be more cohesive, Dr. Diaz? Are we doing dual plane 1, 2, 3? Like, why do you need to know that all as a surgeon? As a patient. As a patient. Like,
we should know that.
Yeah, well, no, we should. But like, you don't need to worry too much about that. Leave some of it into like there's this one book, Let Them.
Yes, that's funny you mentioned that book. Yeah, my wife and I started.
A lot of people are reading that. Let them. Let Dr. Diaz. Let Dr. Diaz. Let Ghavami. You're going there for a facelift. You trust me. Just let me.
But this is another big point, because we just talked about how confusing facelift is, all the terminology, different procedures. It's a lot. There's so much information, but it's for a patient, the average person, it's really overwhelming, right? But finding a doctor is too, and not only plastic surgeons, but now as we mentioned, we talked about this off camera. Is that there are different specialties now that are doing surgery, and that's even confusing too.
It's always been a little like that. I don't know how it is elsewhere, but I know every country has this issue. I think countries like Japan, Korea are very defined about it. They're stricter. We're not that strict here. This is crazy, but if a family practice doctor wants to, in his own little surgery center that's probably not accredited, give you a little Xanax, localize your face with numbing, and do a facelift, he can. If a radiologist wants to do liposuction, which we had one not long ago, who got in a lot of trouble, he was a radiologist, advertised all over the place as this guru of body contouring. there's no, it's, you know, as Rod would say, it's the wild, wild west. Whether you're in New York or here, it's still the wild, wild west.
Yeah.
But I do think that certain specialties, and we have friends in all specialties, so I don't want to annoy anyone. The training we talked about, I mean, if you have extra training and you're either otolaryngology, ENT trained and do facial plastic, or you're plastic surgery trained and you're adept in the anatomy and you want to do face nose jobs, all those are fine. It gets murky when we go into dermatology. Like, they really just prescribe skin stuff. They deal with skin. Maybe some cancer removal, so they do work in the face and do Mohs, and some of them do the reconstruction, but that doesn't mean you're going to be able to know how to do a eyelid lift, or most importantly is when you get in trouble.
Yes.
I mean, I don't know if the viewers know this, but our oral board examination, the majority of that is focused on what do you do when things go wrong.
Right.
You have to, and that's board certification. It's like a car with an engine that works and wheels.
Right.
Now then you have Ferraris and you have Priuses, right? So you have to have the basics of board certification either in facial plastic or plastic surgery to do face lifts and nose jobs.
Yeah.
In my opinion, that's it. Beyond that, if you want to venture around as a derm as something else, you guys are taking a risk. So, and it's confusing, but without belaboring that too much, you just have to ask them if you want, are you board certified and by what board?
Right.
So it's going to be their American Board of Otolaryngology or Facial Plastic Surgery or American Board of Plastic Surgery. That's it.
Right.
Nobody else, in my opinion, should be doing your facelift or rhinoplasty.
Yeah. No, that's good advice. And I was going to ask you what you would recommend for patients, but I think that that's a really good piece of advice and a tip because patients are confused.
Yeah.
Because I think probably 20 years ago, there was a move to an effort to educate patients to ask about board certification.
No one did it.
But some patients did. But the thing is, the way around it is yeah, I'm board certified.
But they don't say
But in
that.
family medicine, or and they don't say what.
Yeah.
So I think what you said is exactly right.
But honestly, I think of it this way, John. They're not our competition. Like, the family practice guy that's doing lipo is not my competition doing high-end S-curves on, like, movers and shakers.
Yeah.
Like, I just don't worry about it.
Yeah.
But for you guys, you should know as a patient consumer, because especially in the BBL fat transfer world, there's family practice internists. They go train under certain doctors that are board certified, get a certificate, call themselves some cool name. That's all they do. It's a little bit concerning.
Yeah.
But,
No, it is. And I think what you said is exactly right. Well, I wanted to just add that I think I shared with you off the recording that I myself have, sometimes tried to educate patients, and sometimes the messaging I've gotten it wrong because we do have a lot of colleagues in other specialties, for example, otolaryngology or ENT, and they are very qualified to do facial surgery, especially if they've completed a fellowship. So I think what your tip was is asking, are you board certified, and then specifically in what? I think that's a great tip.
very important. That's the basics.
Yeah, that's
like that doesn't mean they're going to be adept at various techniques for what you want done, and whether they know how to evaluate what is best for you.
Right.
When I see a patient, I'm not saying I'm God's gift and I'm perfect, and none of us are. We're human.
Mm-hmm.
But I'm pretty good at my age now after all I've seen and the 1,000 surgeries I've done. And when I see somebody's breast, buttock, potential tummy tuck, facelift, whatever it is, nose job, I know what technique I think would be their maximal best that they could get. Yeah. And it just sometimes, honestly, it saddens me when they go and sell themselves short and go somewhere, and no offense to Mickey again and Disney, but like they go and just get like a little tuck, and they could have gotten something so much better. They could have lasted longer, could have addressed their neck better. Why did they ignore their eyelid? Why did they ignore their brow? Like, so there's this maximal best that you can be, but also people either don't have the funds, the resources, they don't know where to go, and it's okay. You might jog in the morning right around your town, and you're still jogging and you're doing well. You don't have to be in the Olympics. But I think of what I want to deliver for each patient, and both you and I are overachievers. We want to get the Olympics level benefits to that patient for whatever it is, breast, et cetera, whatever. Like, you can't do breast augmentation and not know what different cohesivity of your implants are, what their profiles mean, why that might be better in that person. A narrow base to their rib cage, you're not going to be putting some wide implant. Like, these are just things you know.
Yeah. And then you also mentioned another important fact. because it's not only about having that elevation of your skill set, right? Like you're talking about really understanding the procedure, but it's also what you said about what happens when things don't go right. Now, fortunately, I think in the hands of a good surgeon, experienced surgeons, I like to think of myself as one. You obviously are one. The complications are very rare. Issues are rare. But when they happen, we know how to handle them. And we take excellent care of your patient. And in fact, for everyone listening, one of the things we were doing during the break is you were responding to a patient who had concerns. And it's, for people that don't know, it's after hours right now. It's almost 8 o'clock.
I took the call.
Yeah, and that's all we do. And that's what we are. That's how we are with our patients.
We're 24/7.
We are
doctors. We're surgeons.
Absolutely. But not every doctor is. And sometimes I sometimes will say, unfortunately, patients sometimes don't know what they don't know. And it's kind of a stupid saying, but what it means is that unless you have that experience, it's hard for you to tell what's going to happen because you just haven't been through it yet. But when you go to a surgeon like yourself, or like I said, I like to think of myself, you're going to get incredible care from start to finish. And that's unfortunately, sometimes patients don't know that until they run into a problem.
Yeah.
And maybe, like you said, maybe they're tempted by a lower cost or whatever.
Yeah. I mean, I've heard stories, you've probably heard too, guys in town, board certified guys, great guys, and their patient has an issue and they don't even go visit them if they're hospitalized, God forbid. They don't go visit them. They don't ignore them, or, patients need to, hopefully you find a surgeon that's not like that. And then you gotta kind of trust your surgeon. You trusted that person to begin with, to do the surgery in the first place. Put yourself under their care. Some people are too quick to judge the results, too quick to expect something. And I always tell my celebrity patients, I tell wealthy patients specifically, that your body doesn't know who you are. Like, they don't know you have red carpet in 3 weeks. You may not be healed in 3 weeks. And someone wealthy, they're like, oh, I paid so much for this and I'm still swollen and it's been 4 weeks. I'm like, your body and genetics doesn't know you paid this much money. It's going to heal how it wants. Your body doesn't know what you paid.
Right.
So just trust the process and chill. And like this, with this whole review system and people going on like different social media platforms and like, it's almost like soft extorting surgeons and all, that can become a problem in the future, especially with AI and everything. Posting the weirdest results, angles, and not being forthcoming and showing your befores to see what a mess it was, especially with revisions, like things like that. It's a problem. And that beauty broker person, Melinda, talked about it recently. Kudos to her. Dean Toriumi recently wrote a whole long post on social media, and he's not a social media guy really, on how like you have to trust the process and to judge your results, especially from a revision nose job at like 3, 4, 5 weeks. Like, it's insane. It takes 1.5 years to 2 for a revision.
Absolutely.
So people also need to be patient. Once you've done it, you've had the surgery, respect that process. Give your surgeon at least 1 year. If after 1 year they're ignoring you, or they're throughout the year you realize their office doesn't care, they don't care, or that he or she doesn't know what they're talking about, sure, after 1 year you can have a conversation, get a referral somewhere else, or give them a chance to do a little touch-up. We all have revisions. We've worked I'm sure we've all worked on each other's patients. You've worked on your own patients. I've worked on mine. Sometimes if things goes awry, because we're board certified and we care, we're going to fix it and improve it. But it doesn't mean you throw the whole thing out. I use the analogy of when you remodel your house. If everything looks great, but then like the garage is off, the garage door doesn't match, it doesn't mean you tear down the whole remodel and fix it all.
Right.
You just work on the garage. And like that takes 1 year sometimes to figure out what little thing needs to be done.
Yeah, that's a very good point. So you've covered so much, I think, valuable information. If you had, I'm going to put you on the spot.
Okay.
If you were giving advice to the patient listening, someone out there who's considering facelifts. I think you already gave a lot of great pearls, what we call valuable pieces of information. What would you say are like maybe the top 2 or 3 things that you would advise someone to look at when they're trying to find a great surgeon?
One thing would be, if you do some research and you realize what the more advanced procedures are, does that surgeon offer a variety of approaches? So do they do, for facelifting, for example, I feel like they should be at least doing something with the SMAS. Now, if you go to someone who just does SMASectomy plication, but you see their results are great and they're showing you long-term results, They look like they're caring and they're good with other things they've done. Their nose jobs look good. Their breast dogs look good. They're obviously meticulous and caring. Then you're going to be fine. So you don't get too bogged down on techniques. But in general, I think every surgeon should know a variety of approaches to everything. Like you don't just go in and do dual plane 2 and that's it.
Right.
You'll do 3, you'll do 1, whatever. Like you do what needs to be done. I don't go do a high smash on everyone. I do want to, but sometimes they don't need it. But I also know how to do spasticity plication. So ask your surgeon, what different techniques do you do and why? Get into it with them. And then secondly, like get a sense for how the office is, how available they're going to be if something's going wrong, who's your go-to in the office. We have advocates, you have your patient coordinator, the front desk, you have a bunch of advocates in the office. You have email addresses, but also don't take advantage of that and email every other day and like swollen, is it healed when you're like 6 days out? Or something we told you takes a year.
The day after surgery, I have pain.
So I think they need to be very techniques, no advanced, no moderate, no different, things. Just like a chef. It's nice to have a chef for your own home who also knows how to bake pastries, knows pasta, and knows how to make a good steak and pizza. So, and then I'm saying this because it's late and I'm starving. But
I can tell what time.
I know, like pizza. So, variety techniques, be available for you when something goes wrong.
Yeah.
Thirdly, I think it's just gut instinct.
Yeah.
It's hard to explain that, but you just have a gut instinct. This is a good guy. He means well. He wants to do well. He cares about what he does. He's not in this just for the money. He happens to be making money because it pays well and it is what it is. But even if it paid less, he'd be doing it.
Well, like
I always tell people, if this paid less, I'd still do it.
Right, and like any field, when you're really good at something, you're going to be successful.
Yeah, you love company.
Love it.
Trust me, me and him, you drive far too. Like in LA, we go through obstacle courses just to get to work. And on the way to work, if I'm not listening to a podcast, I'm talking to my coordinator. I'm talking to I'm having conversations. Just now in the middle of the podcast, I took a patient call. That's how it is. Right. So we go through a lot to where we're at. So, it's a process to respect, and we would not be doing it for all the money in the world if we didn't like it still. I always tell people the day that I just really dread coming to work or I don't like what I do, outside of how hard it is to run a business in California, which is a whole political conversation, outside of all the logistics and red tape and the complexities, plastic surgery, being in the operating room, seeing a patient that looks great, happy, bringing you a box of chocolates or flowers, and just that 1 or 2 of those a week is enough for me to keep doing it.
Absolutely. No, and I think anyone listening can tell, just like I know this, that you are the kind of surgeon that is like that. And that's why you have had the success you have and why you are so good at what you do. It's because you love this.
Yeah. I take pride in it. And I know you do too.
Yeah. Well, we can keep talking for hours and hours, but I think
we covered a lot.
So before we go, I want you to share with the audience how they can learn more about you. Like I said, anybody that knows anything about plastic surgery probably already knows about it. But for someone that maybe hasn't, how they can find you. I know you started a podcast as well.
Yeah. So we just had my first episode. Yeah. So I have, well, first of all, as we talked with Dr. Diaz, I was fortunate enough to be lucky. It wasn't like just I'm some like amazing social media guru. I recognized Instagram was going to be a thing earlier than some other people. So I started earlier. So I have a very organic, non-follower bot. I haven't bought a single follower, like, or mention, or any of that. I don't do that. Companies approach me all the time. So I have a very organic, actually my follower number keeps going down a little bit, which is fun, whatever.
Well, you're only at like, what, 1 million there?
No, I'm about like 500 something, but like it went down from 600 something, and I don't care. I'm not like, oh my God, what do I do? Yeah. But in general, for plastic surgery, just so you know, especially who do some body work, we're a little bit, quote unquote shadow banned and like blocked. So Instagram doesn't really reward a lot of our posts. Unfortunately, the algorithm's always changing. Yeah. TikTok, I don't know where it's at. So I'm trying to do a little more on YouTube, long format. So if you're interested, you can listen to those. And one of those things is my podcast, which is called Keep Them Guessing, like my tagline. So, and one of the, I think it's the E in the guess is a DNA coil, and then the K has a scalpel in it, because I want to cover wellness, biohacking, because was for my own selfish reasons, because I'm trying not to age much anymore.
Yeah.
So I'm going to hopefully have guests like that on. I want to have you on. We're talking about Keep Them Guessing in the sense that I always said that with plastic surgery, that it should be like, did she or didn't she, or what did she do?
Absolutely.
Kind of confused, like Chris Jenner, like what exactly?
Yeah, it looked great.
Yeah.
Well, what is it?
Yeah, so that's the Keep Them Guessing thing for plastic surgery, but also it's a little deeper than that. It's just like keep them guessing in that life's unpredictable. Keep yourself guessing. And then also, like in my culture, also like when a lot of good happens to us, we don't really share it with a lot of people because of evil eye and energy. So we believe a lot of energy exchange and like evil eyes on you, and like as people call it, haterade. So those kind of things. So you want to keep people guessing as far as like how you are in your private life and who you really are, because there's a persona that they think of you, and then there's who you really are. So keep them guessing as a broad life lesson. Plastic surgery, wellness, all of it kind of combined. So that's my podcast. I've only had one episode. Interviewed Dr. Fritz Barton, who's the creator of the high smash, which is my favorite facelift technique. And then that's really where I'm the most active. So my YouTube channel, podcast now, and Instagram, which is Dr. Ghavami. I have a GPS aesthetics med spa where I do all the lasering, etc. My aesthetics nurse. And then I have a Nose by Ghavami page, which I'm not too active on, but that's where I post most of my nose, specific before afters.
Great. So I invite anyone listening, if you want to learn more, you have Dr. Ghavami here, fascinating guy, amazing, again, a pioneer, innovator here.
Thank you.
And it was such a pleasure to have you on.
Pleasure.
Appreciate it. I'd love to have you back.
And I want to have you on my podcast. So we talk about everything. Thanks so much, Ron. Appreciate it.
Yeah.
This is the Plastic Principle.